Dr. Jean-Paul Amonte. Thank you for joining me in this video where we're going to discuss some natural treatments for common types of headaches. Now, there's a lot of different causes of headaches, but the most typical types are going to be muscle tension headaches, cervicogenic headaches, and migraine headaches. And so we'll address those three. But before we begin, please make sure you consult a physician or a qualified doctor before you begin any treatment program. So I'm going to have Bones here help me out, so you can say, hi, Bones. Oh, he's a good character. So with muscle tension headaches, what we found is that the muscles right in the base of the skull, this bone is called your occiput, and so the muscles deep underneath here are called the suboccipitals, and there's one that actually goes all the way to attach to the tissue that surrounds your brain. And so any tension or tightness in this area can certainly be a major cause of headaches. So take a look at my other video on head neck exercises and try that at home or at work. But you can also do simple massage right across the base of the skull. It's very effective for releasing any tension. And as you're doing this, you want to feel any areas that might be tender or causing a headache referral pattern around the skull or to the face. And then you simply hold and vibrate for about 10 to 20 seconds until that muscle begins to relax. And then gently circular massage, and then vibration again. This is certainly most effective. Also, be mindful if you're wearing any constrictive hats or any headgear, because oftentimes pressure on the skull can often be a cause of headaches. Now, what we can also see here is all the vertebrae in the neck. That's called your cervical spine, and there's 7 of them. And then just below that here is the thoracic spine. And so in my practice as a chiropractor, I found that the most common regions to cause headaches are this upper thoracic region as well as the neck, especially from about the mid-cervical to the upper cervical region. So as you can see, there's actually 3 joints for every level of the vertebrae, 1 on either side, and then the disc in between. So if any of these joints get locked up or compressed, it's going to put pressure on the nerves, and with adjustments and manipulation, we just release that joint. And so if that joint gets stuck and fixated, that's when you're going to feel any discomfort or pain turning your head side to side, is usually the upper cervical, or if you try to tilt, bring your ear to your shoulder, which usually the mid-cervical to the lower regions or in the upper back here. And so I highly recommend getting adjustments or manipulation to help with cervicogenic headaches. Now the last one to be addressed is called migraine headaches. So with migraine headaches, we definitely know that it has to do with the circulatory vessels, that is the blood vessels going into constriction and dilation. And typical migraines, you might have visual flashes or smells before they come on. They're typically on one side of the head. They're very pounding, and they can cause nausea or dizziness and last for hours or days. So one of the best herbs that I found to use with migraines is called feverfew. So the feverfew herb can be found in a capsule or a tincture formula to be added into your water to be taken as directed on the bottle. However, other causes of migraines are very interesting. There's a direct relationship between the gut and the digestive tract. And so you want to look and see if there's any food allergies or sensitivities, and obviously remove them if so. So typical things would be like peanuts, wine, chocolates, things that have a lot of sulfates in them, or any other foods that react to the body. For example, like dairy products will sometimes trigger headaches. And so especially if the gut and the abdomen is involved, I highly recommend using castor oil packs and looking into colon hydrotherapy along with dietary modifications. And so one of the most common causes of headaches is dehydration too. And so how do you know you're drinking enough water per day? Well, if you take your body weight and you divide that in half, that's the minimum ounces of water you should be drinking per day. So if you weigh 400 pounds, you should be drinking about 200 ounces of water a day. If you weigh 100 pounds, about 50 ounces per day. So sometimes just by drinking enough water in between meals can usually help a lot of these headaches resolve. So try these things and heal thyself. Thank you very much, and check out my other videos.